someone talks about fertility preservation. The patient says, okay, well, what's it going to cost? They go run the patient's insurance. Insurance comes back and says, we don't cover fertility preservation. The patient says, well, I can't afford to pay that out of pocket, so I guess I'm just not going to do it. People need to be appealing that decision.
So speaking as a parent and as a mom, we all know that cancer can have a devastating effect on women and possibly leave them infertile. And I believe I was asked when I was undergoing my treatment if I wanted to preserve my eggs. And in that moment, I was just so adamant about wanting to feel better. I just did not care. So it kind of went out of my mind because I wanted to fight as hard as I could to make sure I was okay. So a few years later, now I really wish somebody had explained to me a little bit more about, was that something that I really wanted to consider? Was that something that I was absolutely sure about? So what advice would you have for women as far as, making sure that they are 100% comfortable with, advocating for their eggs for future children?
Yeah. I'm sorry that you had that experience. It's such a hard one. And the conversation around fertility preservation is, in the grand scheme of things, relatively new. We have all this amazing science now, but there are still some barriers. And I think you really brought up one of the biggest barriers, in that people are overwhelmed, right? And when you're making these cost benefit assessments of, I need to live versus, do I want to preserve my fertility? Like, sometimes it's not always clear, and sometimes clarity comes a lot later. The other barrier that we see is that someone talks about fertility preservation. The patient says, okay, well, what's it going to cost? They go run the patient's insurance. Insurance comes back and says, we don't cover fertility preservation. The patient says, well, I can't afford to pay that out of pocket, so I guess I'm just not going to do it. In the latter situation where it's about insurance, that's another perfect example where people need to be appealing that decision. And they can do it quickly. There's an expedited appeal that happens in 72 hours. And we're seeing lots of success with that, where insurance companies then come back and say, we will in fact pay for that. And that at least removes that one barrier. It certainly doesn't solve the issue that you were talking about. For your specific question about, like, how do we make sure that patients really are thinking through this decision, I really have to give a nod to my friends in the social work community. Social workers are an incredible resource for helping people think through these decisions. And I know certainly not everybody's going to have access to that, but to the event that they do, to avail themselves of a social worker, I think is really, really important, to make sure they've really sort of thought through all the pieces. And to be honest, this is for men in addition to women, because men also face fertility challenges and need to be thinking about preserving that fertility. Now, sometimes for men, it's a less invasive process, but it still needs to be a part of a conversation for young adults.
Okay.